This is a study of our own clinic at Hopkins. I run the young adult clinic at the Sickle Cell Center for Adults in Baltimore, and we looked at participation in visits to the young adult center, and we're particularly interested in attendance at that first visit when people come to establish care. What we looked at was 193 subjects who were a mean age of 23.8 years, and most of whom were publicly insured, and about half of whom were taking some treatment for sickle cell disease. And the majority of those subjects did establish care in our clinic. 89% of them did. And perhaps more remarkably, when we looked at referrals and attendance at visits for patients who were explicitly aging out of pediatric care and coming to the adult sickle cell center in that context, 99% of young people, 76 out of 77 of the young people who were referred to us directly from pediatrics to attend the young adult clinic did participate in their first visit. When we looked at who was at risk for not attending visits, the risk factors included it being in care reentry, that is, having fallen out of care between pediatric and adult care, relocating for care, and having a longer distance in time from the last pediatric visit to the first young adult clinic. And then another part of our care system, which is accounted for in this data, is that 22 subjects never attended a young adult clinic visit, but 7 were seen by our advanced practice clinicians at the center. And so it was only 15 patients out of these 193 patients who were never seen in the center. And so we've shown that a majority of patients will engage in care. In this same cohort, we had 4 deaths and 4 successful bone marrow transplants. So 8 patients had extremely life-altering events associated with establishing care or none. I think those were the main takeaways from this study. Among the things that we also identified were that there was a higher proportion of women than men who engaged in care, which sickle cell disease does not differentiate by sex. So we assume that there is some need for attention to young men, and that because they may be falling out of care between pediatric and adult care.